Diagnosis on coronavirus.
We will discuss today the pandemic disorder COVID-19. COVID-19 is caused by coronavirus 2, otherwise called novel coronavirus, SARS novel coronavirus. We will discuss in glimpses about the disorder which is pandemic in the world.
Difference between human cell and coronavirus.
The relation between the human cell as well as the coronavirus. Let us see, the human cell is comprised basically a outer membrane and it has a central nucleus and it is comprised with genetic material deoxynucleic acid and for the various production of the various enzymes and proteins, the ribonucleic acid. These are the key components which are essential in the human cell. When you can come to the virus, the virus either consists the DNA or RNA, any one only. So in the present scenario, the novel coronavirus consists as its central material, that is nucleocapsid, consists the RNA strand. This RNA strand is having around 28,000 and odd genomic material is present in this. Now if you can see the coronavirus that can have the abbreviated, just you can see like this, NMES. So this comprises with 4 varieties of proteins. The protein N indicates nucleocapsid and protein M indicates the membrane and protein E indicates the envelope of the virus and the S indicates the outer protrusions which are known as spikes.
Classification and category of coronavirus.
The coronavirus, if you can categorize or classify, there were about 7 varieties of coronaviruses are present. These coronaviruses are pathogenic and they cause disorders in the human beings as well as in the animals. Among them, the present coronavirus, novel coronavirus, that is SARS-CoV coronavirus 2, is now comes under the 7th variety of coronavirus, classified as class B infectious disease. But the management of the disease requires class A infectious disease management.
Diagnosis of coronavirus.
Identify the infection of the coronavirus is by many means. As of today, the RT-PCR is the most authenticative results we are getting through that one. And second one is IgG, IgM rapid test. After these two, now we can see in the urine as well as in the feces material also, the virus is sustaining. The virus is more vulnerable towards the pulmonary cells, that is alveoli lung cells, particularly on the receptors, ACE2 receptors. In the investigations, it has been found that the infected patients the blood test shows lymphopenia, the reduction of the lymphocytes, and the neutrophilia, the increasing of the neutrophils. The lymphopenia and neutrophils indicates that the COVID-19 virus is stimulating the high level of infection or the immune system in the human body. That's very important point to be noted. The CT scans which have been taken are showing the glassy patches. So the virus infection indicates with the symptoms like mild flu, the cold, dry cough, the fever, myalgia, the body pains, up to the severe pneumonia levels. This is how the virus is spreading inside the human body.
Coronavirus pathophysiology.
About the pathophysiology between the human cell and the virus, if you can look into that one, The coronavirus is having a spike. The spike is the essential component which is attaching to the ACE2 receptor on the human cell. The ACE2 receptor human cells are highly present in the lungs and kidneys, intestines, that is gastrointestinal tract, and a few on the liver. Now you can see the spike, if you can look into this one, is having two subunits. The two subunits. So the subunit 1, this is S, spike S, it has S1 and S2. The S1 attaches on the surface of the human virus, whereas coming to the S2 is having RBD, receptor binding domain. So this receptor binding domain is having 6 varieties of amino acids. So the 6 varieties of amino acids are cleavage towards the human cell at the receptor ACE2. So the ACE2 receptor, here it is there. Therefore, it requires an enzyme present here in this area. The enzyme is serine. The serine is like a trypsin enzyme. It is a protein, trypsin protein enzyme. So, this enzyme is an essential component for the complete attachment of the S2, that is the spike S2 here, and S1. S1 is meant for surface attachment, S2 is meant for the cleavage. So, through this, at the RBD, that is the receptor binding domain, this is penetrating inside the cell by cleavage. After this one, in the cell, the virus is multiplying, it's developing like anything, and it is becoming and acting as the viral reservoir. So this is entering, particularly if you can come to the lungs and the alveoli surfaces, you can have the epithelium type 2 cells. Epithelium type 2 cells consist of more ACE2 receptors where serine enzyme, that is a trypsin-like enzyme, is allowing the subunit 2 of the spike of the coronavirus for the cleavage. Thus, the virus is entering and multiplying and causing infection to the human body, so that it is acting as a viral reservoir. So once the viral reservoir is splits, so the several viruses is attracting the uninfected cells and causing infection.
Infection of coronavirus.
Through person-to-person contact and by fomitive contact and by droplet infections. There are 3 modes. When an infected person can be contacted by a non-infected person, the virus is transmitting in that line. Number 2 is through droplet infection. The droplet infection, there are 2 distinctions are in there. The World Health Organization suggests that the droplet which has been split out by the patient, the coronavirus positive person, would reach up to 3 meters, up to 3 feet, that is 1 meter. So therefore, physical distance maintenance of 1 meter would prevent it. But Massachusetts Institute of Technology in America, they recently found that the virus is spreading at about 27 feet from the split of the coronapositive patient. That is through droplet infection, they stated. However, the absolute results, research results on this are yet to come. So, the best prevention, as 6 points that has been World Health Organization stated, have to be adopted apart from the lockdowns, isolating ourselves. These are very essential since this is the prevention. Now coming to the treatment, there is no targeted or specific treatment as on today is available to the COVID-19 disease. The only treatment that is being adopted in the entire world as on today is the symptomatic treatment and isolating the patient. Symptomatic treatment is perhaps if the virus infects through digestive system. In the fecal matter, the load of the virus is increasing. So the patient is getting a symptom of the diarrhea. where the antidiarrheal drugs are applied. So when the patient is getting the respiratory impact, so they say from upper respiratory infection to the respiratory tract infection. So it's a mild cold, dry cough, and they are on breathlessness. So for all these things, so the symptomatic treatment they are adapting depending upon that one. Some of the patients are developing with the myalgia, muscle pains, where the myalgic treatments, drugs will be administered as on today. So as on today, only symptomatic treatment is being in use the entire world. There is no specific treatment is available to the coronavirus, that is COVID-19.
Temperature and moisture effect on coronavirus.
Up to 13 degrees temperature, it is showing very high impact. Now, the recent studies found that the temperature, if increases, that beyond 32 degrees temperature, centigrade temperature, the impact of the virus in its communication or contamination is reducing a little bit. So this is one of the important aspect to be noted, that the high temperature is preventing the spread of the virus, coronavirus, to some extent. It's only a prediction. The studies, one Chinese study has shown that, and the time when the coronavirus was outbreak in December 2019, which has been known to the entire world on 9th January 2020, there the temperature at that place is less. As the temperature increasing by this time, the cases of corona were reducing stably in that Wuhan city. And if in other cities of the China, it is known that the temperature is very high and the spread of the disease has been remarkably is reduced. Of course, the temperature is not playing a major role, that the only temperature is the cause of reduction of the disorder, COVID-19. The other aspect, that is the isolation, lockdowns, and distance maintenance, physical distance maintenance. These are also the important factors in controlling of the spread of the coronavirus.
Why coronavirus incubation period long and effect of coronavirus on DM, HDN, COPD, HF and CKD patients.
Has been revealed that many of the coronavirus infected patients are showing their symptoms after a long period. The incubation period of the coronavirus is taking minimum 5 to 14 days to come out. For this, it has been seen well. If you can know the immune system of the body, it is very well known. And once the microorganism entered inside the body, it may be bacteria, it may be parasite, it may be a virus. So, what will be taken place? Naturally, the signaling system in the body, immune signaling system, will rush there by releasing the cytokines and cytochemicals, interleukins, interferons. So, the communication to trigger the T cells into the risk of the fighting with that of coronavirus, this information from the cytokines to the target cells is taking larger time. So because of this larger gap of the communication from the cytokines to the T cells, that duration of the period is the cause for the late symptoms exposure in the patients who have been affected. So therefore, there is alarming in India particularly, where 130 billions of the people, out of them, there were about 30 to 40 crores of hypertensive patients, and there were about 5 crores of diabetic patients, cardiology patients, heart complicated patients, and more than nearing 10 crores of diabetic patients are there. So now you can see the around 40 to 45 crores of patients are very to be cautious. When once the coronavirus affects on them, the impact of the coronavirus is very complicated in them. So that now if you can see the census of the coronavirus patients, we can see below 45 years patients are the symptoms are resolving themselves with the innate immune system within them. Now the rest of the people, around 26% of the people in the population are rushing towards the hospital and requires the hospitalization. In the hospitalization patients, those about 5 to 6% patients are requiring the ventilation. So there is a mechanized air supply, oxygenation. So the supplementation of oxygen. The supplementation of oxygen requiring people, or majority of the people are either immune compromised, or the diabetes mellitus, or cardiac disorder patients, or respiratory disorder patients such as COPD, etc. So all these people are very prone to the complications of the coronavirus, novel coronavirus infection of the present pandemic infection. So therefore, these patients better to be stay in the home, better not to be with the mass areas and be not mingle with the many people, and better to take the self precautions as World Health Organization has been stated. Thus, they will be saved from the life and by improving the immunity and by taking the balanced nutritional diet.
Effect of HNT drugs on coronavirus.
Issue why the coronavirus is drastically affecting on the lungs, and it is sparing so many other organs, and it is affecting, of course it is damaging the multi organs, no doubt, but the impact on the lungs it is high when compared with the heart, and when compared with the digestive system, and when compared with the kidneys and the liver. As we know well, the ACE2 receptors are abundantly available on the surface of the alveoli, that is the epithelium type 2 cells of alveoli of the lungs. So this is happen to be the very crucial receptor for the cleavage of the coronavirus into the alveoli, thus to making this alveoli epithelium type 2 cells as the reservoir for the coronavirus. So that is the reason the lung is highly and primarily is getting impaired or injured because of the coronavirus infection. Now it is the question whether ACE2 inhibitors and the ARBs can be used by the people. In India, we know well that about 30% of the population, that is nearly 35 to 40 crores of population, are suffering with hypertension, that is BP, high BP. We know well majority of the hypertensive patients in our country are being on kept medications of ACE inhibitors and ARBs. It is a recent research has shown that the ACE inhibitors and ARBs is giving little complication in treating the patients suffering with COVID virus. So better the hypertensive patients to switch over at least for this pandemic period, to switch over from the ACE inhibitors and the ARBs to the CCBs, the calcium channel blockers. So that we can strengthen the ACE2 controlling system in the cleavage of the coronaviruses into the alveolar lungs. So better we have to switch over or take medications for the hypertension and for the diabetes mellitus. The diabetes mellitus patients and the cardiac patients, as well as the respiratory system disorder patients such as COPD, all these naturally will have the less immunity power, and in them the ACE2 receptors are playing a major role in worsening the condition if they were infected by the coronavirus 2, that is the novel coronavirus infection.
Effect of hydroxychloroquine and azithromycin tablets on coronavirus.
You can see European Medical Agency issued an advisory. In that advisory, they stated that hydroxychloroquine as well as azithromycin, they both will give little benefit to the COVID-19 patient. If you can look into the hydroxychloroquine tablet, the hydroxychloroquine has been shown little results that it has been reduced the load of virus in the body. It has been reduced the stay in the hospital. So the research has revealed like this: the stay of 17 or 14, 15 days has been reduced to 6 days in the hospital. Now coming to the azithromycin, as we know well that it is an respiratory antibiotic, mycobacterial destruction, we are using that one particularly in the pneumonia cases. So therefore this antibiotic is acting as a counter for the alveolar protection, say such as the epithelial 2 cell on the surfactant of the alveoli. It is well active. So the combination of both SCQ as well as this azithromycin are showing better improvement and giving a little hope even in the symptomatic treatment. Now coming to the use of paracetamol. Paracetamol, as we know well, it is an antipyretic. This can only be used when there is a fever in the human body. Naturally, the fever is supposed to be a positive indication for the viral or mycobacterial infection. In other words, the fever is defined as a signal for stimulation of the immune system of the body. So therefore this indicates that there is a cytokine and interleukins and antibodies signaling against the microorganism which has been entered into the human body. So therefore paracetamol, though it is not a specific and targeted drug to reduce the novel coronavirus infection, but it is being used as a antipyretic for the controlling of the fever. Since you are applying the hydroxychloroquine and you are applying azithromycin and other symptomatic drugs, so therefore to control the fever, this is also being used, since the antimalarials and the antibiotics and the antiviral drugs are also administered, so there may be not much use of continuation of the fever in such a patient. So therefore this is being used to control the fever in the COVID-19 patient.
Effect of Ivermectin drug on coronavirus.
Ivermectin antiparasitic drug is being much used in veterinary medicine. With some precautions, with a fine quality, is could be using in the antipyretic treatments as a broad anti-parasitic drug in the human body. Now, a research has been conducted in Australia very recently and found that in vitro, this ivermectin has been inhibited in 48 hours about 5,000 folds of the SARS-CoV-2 virus, that is the present pandemic virus, beautifully. It means it does not supposed to be immediately be administered on the human body. Why? Because the very same drug ivermectin previously has been shown in vitro the best results in case of Zika virus as well as in the dengue virus. But in Thailand from 2014 to 2017, the drug has been administered in many cases of the dengue virus. Though the drug was a safety on the human body, but never shown any results in inhibition of the similar virus, that is dengue virus. So the results in vitro were always not the same as in the in vivo. So therefore the drug, unless and until the scientists have been further investigated with the safety precautions, whether the drug have the same impact that has been shown now on the COVID virus in vitro and in the human body as the same, till such time the drug may not be more effective, it cannot be much more used as a self-medication. This is
Coronavirus natural or human-made?
novel 2 is having the genomic resemblance of the SARS coronavirus which has happened in the last decade. It was happened in the last decade in the very same China in the Annan city. From there, so the genome sequencing of that virus and the present COVID-19 virus is resembling about 96 to 97% is equally. Therefore, the doubts have been arisen in many corners of the world that whether the coronavirus novel today's, that is the SARS-CoV-2, coronavirus 2, is a recombinant and an artificial or a synthetic or a natural one. So the source of exactly is not known, whether it is a natural or it is a laboratory escape. But some researchers is going on this aspect, but some are revealing that, some documents are revealing that there were laboratory escape of the SARS coronavirus from the very same China, and this may be one of the cause, or it might have been recombinated as coronavirus 2 is not clear as on today. The further researches would only reveal, the time will reveal the same in future.
Latest investigations on coronavirus.
Countries in the world are engaged in identifying the new vaccines or the new drugs exclusively to work on the killing of this novel coronavirus impact on the human cell. Now you see in journal Cell on 4/4/2020, which is happened to be the latest hope for a specific drug for the virus, novel virus, coronavirus control, that is HRS-ACE2, human recombinant soluble angiotensin converting enzyme 2 drug they have been invented. This drug acts as an inhibits its SARS coronavirus at ECU2. This inhibits the impact of the novel coronavirus on the human cell. So the clinical trials of the drug have been already completed, and phase 1 and phase 2 are already completed. Now on the safety of the drug, the works are under progress. So we may hope that the human recombinant soluble ACE2 may come soon, and that will help in prevention or in controlling this novel coronavirus, which is a pandemic in the present scenario.